without Jamie. Okay. So good afternoon, everyone. And here we are to the Wednesday, September 30th workshop for the Lebanon County Commissioners. This is being recorded, and if will become part of public record. If anyone is wishing to comment, please raise your hand. And if the chairman allows, we'll allow you in.
Okay.
So who are we bringing in? All these. I don't know who these people are, so. I don't know who's all from Highmark, so I'm not sure who I'm all bringing in.
It's Doug Kallenberger. I'm not sure if you can hear me.
Yep. Okay, Doug.
We can. Okay. Good afternoon. It would be myself, Craig Bonebreak, and then there should also be Mike Musser and Dave Feit from Community Networking Resources. You see those folks on there?
Mike Musser, did you say? He's on the bottom, I believe.
And Dave?
Dave Feit, F-E-I-D-T. And then Craig Bonebreak from Highmark.
I don't see a Craig.
Oh, he just sent me an IM. He seems to be having an issue. He says, "What is the password?"
There's Doug Kallenberger. He just came in.
He's speaking.
He's speaking.
Yep, that's me.
We're looking for Craig.
Yeah. Let me IM with Craig here quick. I don't think there was a password.
No.
Oh, now he says he's on. Did you see him in the list?
How about Chris Eichfeld? Who's that?
I think you're on mute. Hello, everybody there?
Yeah, Chris is on mute.
But who is that?
I hear Craig.
Hi, can you hear me?
Craig, yes.
Okay, sorry about that. Yeah, I could see you guys for a few minutes here.
And then how about Mike Musser?
Yep, I'm here.
Okay. And Dave Feit.
Yep, I'm here as well.
And then now I'm not seeing myself or any of my colleagues. I'm assuming you can see us.
We can see a hard copy of you, Douglas.
Oh, okay.
Did you want to turn on your video?
Well, I'm only being given the opportunity to do audio right now is what I'm seeing on my Zoom. My bottom left, it's just the microphone.
And that's the same with me.
Yeah, me too.
And who are the other two? Chris Eichfeld and Don. Who are they? Are they just spectators or?
I'm sorry, what was this again, Mr. Phillips?
Chris Eichfeld and a Don. It just says Don.
They must be spectators. Yeah.
All right. Well, let's proceed with the proceedings. How's that?
Well, with the other item we just need is to be able to share with you our presentation. I know that had been shared with Jamie previously, but again, here on this Zoom, I don't see the ability to share our presentation unless you have it already.
Jay, any luck with that? Or Michelle?
Yeah, we're still working on getting Jamie in.
We're very good about that, but they're trying to figure out how to show instead of just talking.
Their cameras have to be on.
Yeah, Mike, I'm good. My camera's on, and
How
it's
did
just
you
not, it's just not giving me the option to actually turn my camera on or off. So you're probably just seeing my profile picture.
Let's see, hold on.
Yes.
Give me 1 second. I'll promote you to a panelist and that should actually bring you.
I think that's probably,
Yeah, my camera isn't on either. It's Mike Musser.
Can you see us?
I can see everybody.
Yeah, I can see
Okay,
this
so
is
we
Craig.
can't see you, but you can see us.
Yeah, they're working on
Interesting.
that. But
all right, now I was promoted, which I appreciate the promotion.
there you are.
There he
There you
is.
go.
All right.
And you may start.
Right.
I'm going to see if I
There's
can
Mark.
get Jamie to join over here. I'll be right back.
And there's Michael as well. Okay.
And then,
Yeah, once you let us in, that all worked out real well.
Oh, there's Dave. Okay. Craig, you're the lone holdout there.
I have a face for radio, so that's fine.
So that's by choice, is it?
No, I have my camera should be on. I don't know.
Oh, okay.
Let me see.
I think Jay's
Oh,
working.
here we go. Here we go. I didn't have the
There
opportunity.
we go.
Wow,
All right, let's-
right there.
Welcome, one and all, and whoever's going to lead the discussion may begin right now. And let's move.
okay, Craig.
Yeah, well-
share the presentation and
Yeah, sure.
things off.
Okay. So share the screen, and here we go. Can you see that?
Not yet. Coming
It's
in. There you go.
coming. There it
There
is.
you go.
All right, technology, you gotta love it. Well, we recognize your time today, so we'll keep this brief and to the point and answer any questions that you have. But we really appreciate the opportunity, and thanks to Mike and Dave for setting this up. Doug and I are excited to talk about Choice Blue and some opportunities that we think can help the county of Lebanon. And I guess before we get started, I want to just kind of see where you guys are. I know you're with the PCHIPIC consortium through Benecon, and I mentioned to Jamie and Bill in the email that I had sent out prior to this presentation that Highmark does work with PCHIPIC and Benecon. So what we would be presenting today is something that you can take into your consortium, and every group, every county within the consortium, as you know, has unique opportunities and unique benefits. And so this is something that Lebanon County, if it works for them, this product can certainly go forward on their own, and Benecon would accommodate the pricing and be able to facilitate through those means. So I guess this is a broad question, but where are you? I know we're, kind of getting into that fourth quarter for open enrollment, and you're a January 1 effective date currently with Capital Blue Cross. Doug and I are not that familiar with your benefits, but assume you have a broad network PPO and maybe some collective bargaining. So if someone can just give us a couple bullets on where you are, so we can really isolate what points we want to focus on, and when we talk to you about what we can offer with this product.
Michelle, would you like to give that guidance there?
What specifically are you looking for? Deductibles, copays?
Well, I mean, you have a broad PPO with deductibles in and out of network benefits. As far as the process of your renewal and where you are in your decision-making process, are you still open for opportunities for January of 2021? Kind of a broader brush than just the current benefit plan design.
It's a question for the commissioners then.
Okay.
I thought we had decided, but we're meeting today, so.
Okay. Well, it's not. I just wanted to get a relative base because we're coming at you. It's the first time to have this conversation, and we just didn't want to talk at you with a product. But why don't we go ahead and just start talking? We'll give you our PowerPoint or presentation, and then we can fill in the gaps with questions. And feel free to stop Doug or I as we communicate this. So Doug, did you want to start out? And we'll give you an update on who is Highmark and what lines of business we represent and kind of a more holistic view. So Doug, did you want to take that?
But if I may first, just would like to thank everyone for your time today and certainly appreciate your interest in learning more about Highmark and learning about Choice Blue, our new creative partnership product with WellSpan, with Penn State Health and Lancaster General Hospital System. So we're really excited about this opportunity. It's been quite some time since we've actually been engaged with the County of Lebanon in discussion around your benefits. And again, just to reiterate Craig's point, we are in partnership with Benecon. We do a lot of business with our friends at Benecon, and in no way, shape, or form is this to undermine any relationship or efforts that you have with them. It is actually to supplement and support further partnership with Benecon and PCHIPIC, possibly through the use of this Choice Blue strategy. So just a real quick on who we are. As mentioned, we represent Highmark Blue Shield. We are the health plan division of the larger organization Highmark Health. Highmark Health is our parent company. It's a Pittsburgh-based, not-for-profit organization. We are one of the nation's 10th, we are the 10th largest insurance company in the country. We're the 4th largest Blue plan in the country. We are the first Blue plan to become what is called an integrated delivery and financing system. What this means is we own a hospital. We own a hospital system in Western Pennsylvania called Allegheny Health. That's a very unique situation. Not many health systems own health insurance companies, or vice versa. Not many health insurance companies own health systems. And so it's a really unique status for us as a company, again, as a not-for-profit, to be able to not only insure the benefits, but to be able to provide the care as well. We will spend a few minutes talking about the unique relationship that we have with Penn State Health. While we don't own Penn State Health, we are an equity partner in Penn State Health with about a 15 to 20% stake in that organization. So, and then finally about Highmark, again, 35,000 employees across the country through various divisions, through the health plan that I represent, through United Concordia, our dental insurance company, through Highmark Insurance Group, our stop loss company. I mentioned the health system, Allegheny Health Network in Western Pennsylvania, and then HM Health Solutions. That's our IT platform. So the folks that manage the day-to-day claims systems operations, those sorts of things. So that's not only our membership that's on that platform, but we have about 10 million other Blue Plan members from around the country that also sit on our platform. You might be familiar with Independence Blue Cross of Philadelphia. Their membership, while we don't have any ownership stake in Independence Blue Cross, their membership sits on our platform. They buy their IT infrastructure from Highmark through this HM Health Solutions division. You know, why is all of this important to you? In the days and the times of rising healthcare costs, there are various ways in which we can manage and control the escalation of healthcare costs. One, by owning a health system. Two, by being a large organization that can have the wherewithal to sustain itself and to support ultimately the employer and our members through challenging times like COVID or other major catastrophic claim situations. And as we all know, COVID is a very expensive healthcare condition, and there are many others out there that cost millions of dollars. Smaller health plans, 400, 500,000 member health plans, can be challenged if they're hit with multiple high-cost claimants in one year, and ultimately have a significant burden that appears there. So again, I tell you all this because of the depth and the breadth of our organization, and again, I think there's a lot of different solutions that can be delivered through Highmark and our separate entities. So Craig, if you want to move on to the next slide. And I'll kick things off about Choice Blue. So Choice Blue is a product. It is ultimately a product strategy that we have developed in partnership with Penn State Health, with WellSpan, and the University of Pennsylvania Lancaster General Health System. And what that means is they've agreed to partner with us in this product, and in return, they provide our members in this product pay better than traditional market discount on claims costs. So if for example, if you're a traditional PPO member in Highmark and you have a $10,000 claim, that's the discounted amount. PPO member pays the $10,000. Under Choice Blue, if it was a facility claim under Choice Blue, that would be at Penn State Health. Let's just use as an example. That claim would be $8,000. So Penn State Health has kicked in a 20% discount on claims costs to our Choice Blue members by being a part of this partnership. In return, the benefits are designed and structured in a way that incentivizes the use of Penn State Health, incentivizes the use of WellSpan, and incentivizes the use of Lancaster General. Both WellSpan and Lancaster General have also invested in that product, or in this product rather, from anywhere from 15 to 20% investment that each of those have made. So what does that really mean to you at the end of the day as a decision maker, as someone who's looking at the financials for the county, is that Choice Blue is a product solution and a financial solution that can deliver care through those primary providers at a significantly lower cost than what you're seeing today through your current provider, or even through Highmark in our broad network PPO plan design. So we're very excited about it. We believe it's a game changer in the market, and really it is a solution that many employers are very interested in learning more about and jumping on board with this product strategy because of the ability to bring down the cost of care through this solution. So any questions so far before we dive in a little deeper?
Anybody have any questions? No? Keep moving.
Okay.
So go ahead.
You want to take over from here then?
Sure. Just a little bit of history and a little bit of education on where we are with how we're contracting with providers. Doug did a nice job setting up Choice Blue, and Choice Blue is really a part of a roadmap that we started probably 8 or 10 years ago. Are you familiar with fee for service? It's a reimbursement methodology we had about 8 or 10 years ago where we would pay for volume. So if a provider submitted a claim, we would pay based upon the submission and making sure all the eligibility things were checked. But there was no real incentive or quality checks to manage where those providers were. So we held our fees for our fee schedules, those allowances that we pay to providers about 8 to 10 years ago, and set up a patient-centered medical home or program where we actually then are paying providers for quality. And those providers were primarily primary care physicians. Primary care physicians, you may or may not know, control only about 2% or maybe 3%, a very small percentage of an employer's spend on healthcare. But if you think about how you engage or how your employees engage with a primary care physician, they control about 75% of where those members go for utilization. So we were able to pull that data, and having the depth and breadth of business that Doug talked about on that second slide about who is Highmark, we were able to pull that data and figure out, who do we want to partner with? So as these primary care physicians were submitting and sending members to different facility locations and things like that, we were able to configure who were the higher performers and who was creating better quality and who we want to make those partnerships with. And so out of that came Choice Blue, one of the products that we're able to offer, and we're happy to be able to offer it in this market because it is a true differentiator. And we recognize the value of WellSpan, Penn State Health, and Lancaster General in that product. So again, that's a quick history lesson and brings you up to kind of that roadmap of how we got from where we were to where we are with Choice Blue today. I think it's relevant because when you look at the data that we've pulled from those years of experience, we've been able to reduce emergency rooms visits by 10% and hospital admissions by 17%. Again, something in a fee-for-service reimbursement that we had 10 or 15 years ago, we weren't able to control that quality and incent those providers and partner with those providers to have those improved outcomes. I mean, heck, these hospital systems recognize that they are a part of the community, and as the health and welfare and economic value of the community grows and prospers, so do they, and it's a mutually beneficial arrangement for these hospital systems. So that's been a really nice turnaround to be able to partner with providers, hospital systems, and include them in that, not just the fox watching the hen house is the way the insurance used to be. We're now in collaboration to help serve our members as partners. So Choice Blue, I'll skip the slide and go right to what this product is. And Doug had mentioned Choice Blue giving the incentive to a member to get to those higher performing providers such as Lancaster General, WellSpan, and Penn State Health. So what we've done is just taken, you have a broad network PPO. So your current benefits today really would just have two columns, an in-network and an out-of-network benefit. So what we've done with your in-network benefit under Choice Blue is taken that network and provided an enhanced value benefit and a standard value benefit. All of it is assumed in-network. There's no balanced billing if you're in the enhanced network or the standard value network. But the difference is your member would pay potentially a lower deductible, no co-insurance, or lower co-payment if they choose enhanced network providers versus those standard network providers. So we're creating that incentive through the member's wallet to get them to those higher performing, and we're at this point, as Doug mentioned, 20% lower on facility bills for the lower cost hospital systems.
So Craig, if I could just jump in and say, in a normal circumstance, if the timing was right and there was enough time to evaluate your group specific spend, where your employees are going for their health care, we could actually do some pretty simple analysis to show you the actual value, the actual value of Choice Blue if you were to lift and replace your current plan design and put in a Choice Blue. Through a simple utilization report with a top provider listing, we could sit there and say, okay, you had $2 million in spend at WellSpan for inpatient facility and outpatient facility, and you had $3 million at Penn State Health, and you had $500,000 at Lancaster General. We could then do the math and ultimately project out for you what kind of savings Choice Blue would represent over your current fee schedule structure that you have with your incumbent administrator. So that's one part of what we could do there. The other part of it is knowing that there is sensitivity due to collective bargain agreements or what have you. We would have the ability to do disruption analysis, gathering some specific detail and data from your current administrator and being able to provide you an idea of how your employees would access care or may be disrupted by introducing this plan. And with where your county is situated and likely the care that your employees and their families are going and getting, they likely are going to WellSpan first. They are likely going to Penn State Health second, and then they are likely going to Lancaster third. And there may be some UPMC mixed in there. Unfortunately, that's where UPMC is in that standard tier. That's where there could be some disruption per se. But for the most part, we could do the analysis, show you the numbers, and make some projections around savings and access rates.
So just to take Doug's points a little bit further, the next slide that I have is these are the actual facilities that are in the enhanced network, and then the standard value network benefit. And again, we can once we are engaged with you on a deeper level, we can talk about the claims projected claim savings, as well as the provider disruption potential for your membership. So we introduced Choice Blue in January of 2019 in Berks County, and then we've just expanded it to the counties that are below Berks on this chart. And we've had exceptional growth in these products. So if you have friends or neighbors or relatives that are at Bell & Evans, Bell & Evans is actually a Choice Blue early adopter of Choice Blue. And we have a significantly large employer in Berks County and employers throughout all the counties that are listed in here. So it's a tried and tested product that's been on the market, again, since January of 19. We have some testimonials from private employer groups that have brought this in, have showed savings not only the first year but through the second year, and are sustaining savings with that. So again, I think it's just an important point to know that, you know, we're not bringing this out to you just as a pilot. We do have existing membership in that is a strong testimonial for it, and we can provide any references or referrals for you. One other point I wanted to mention in the Choice Blue, because most of your employees probably live in Lebanon County. You saw the other additional counties there where in the previous slide where we have enhanced access. But we also have enhanced access through Lehigh Valley Health Network in the Lehigh Valley, of course, and in the western part of the state, Allegheny Health Network. And one important point is that we also cover, you're familiar with Blue Card today, having a Blue carrier as your administrator. Highmark also has Blue Card, being a Blue branded company. And those Blue Card claims, anybody outside of, in the Independence Blue Cross territory, anybody in Maryland or New Jersey would receive the enhanced level of benefits. So we do have a nice safety net for members that do go outside of those counties and won't be penalized for that. So it's a nice peace of mind that, again, we can provide that evaluation as Doug referenced to those provider accesses. And then the last couple slides, I won't go through those accolades, but I think we're very fortunate to live in central Pennsylvania, where we have access to quality healthcare systems. World renowned, you know, Penn State, WellSpan, and now Lancaster General with Penn Medicine. So, and we're happy and proud that we're partnering at Highmark with these state-of-the-art hospital systems. So I'll let you take those on your own and you know.
Craig, may I interrupt Craig for a moment?
Sure.
Since we did get a few minute late start, I don't want to be having you rushing through this beyond what you're comfortable with. So
okay.
We need a couple, you know, more minutes past 2 o'clock. We have another block of time that we have to,
okay.
Like meeting, but I didn't want to.
No, I appreciate that, Bob. I was probably talking fast and sliding through here.
It's all good, but
recognize it was 2 o'clock, so I wanted to be respectful. But
let you know, we go a few minutes if you need it.
Okay. Well, I'll go back to the subject matter of the product, the network, and everything that Doug and I have talked about so far. We've kind of thrown a lot at you, but we really want to make sure we're driving home the point that, you know, we're thinking outside the box with this product, and we've asked our provider partners to think outside the box. Are there specific questions on the product itself and maybe how it would work or not work? If you can think of things for the county and where you are with your benefits today, having heard what we have talked about, I'll go back to my initial question. You know, where are you today, and what are you looking for in the future as far as you know, the benefit plan, your collective bargaining unit, and financially, you know, what kind, you know, obviously dollars are important. So, you know, how do you value those types of things?
Hey, Craig, it looks like Joellen has a question.
Yes, Joellen.
Commissioner, let's go ahead.
Thank you, Mr. Chairman. We have a program with our current carrier where if our employees go on vacation, they can purchase, I don't know if it's $100 coverage if they're in another country. Do you have anything similar?
We do, and we can share that. Geo Blue, again, being a Blue affiliated Highmark, you know, or branded company, we also have the availability for international coverage where we would have reimbursement rates and things standardized for members that are traveling out of country. It's called Geo Blue, and we also can create, if it's a longer term, maybe an expatriate type of arrangement where we can create an actual policy for a member outside. But if somebody's just on vacation for a few days, Geo Blue is the point that we would offer. We used to call it Blue Card Worldwide, but now it's called Geo Blue. So we do have that.
It's likely exactly the same thing that is offered by your current administrator. And for just to add a little bit more to that, so if it's not international, but it's California, it's Florida, it's Iowa. Ultimately Blue Card, as Craig mentioned earlier, Blue Card, that little suitcase in the bottom right-hand corner of your ID card, allows you access to any of the Blue plans around the country, to their networks, and it would provide coverage at the enhanced tier. So members would not be negatively impacted if they went to a Blue Card provider outside of Pennsylvania. They would be seen at the enhanced tier and would not be subject to standard tier benefits. So knowing that we have another minute or two, any other questions before we wrap this up and talk about next steps?
Anyone have any questions at this moment? No, go ahead, Doug.
Okay. Well, in closing, I just would like to say thank you again for having us on this Zoom meeting. We certainly appreciate the opportunity to give you a little bit more about Highmark, who we are. It's been a while since we've had the opportunity to connect with the county. We'd appreciate the opportunity to continue engaged conversations over the next several weeks, several months, whatever the duration is. We recognize we're talking to you here almost on October 1st, and January is not too far away, believe it or not. If there is an interest in understanding the projected savings that Choice Blue would represent, possibly for this January, we can do that. We're glad to turn that around quickly. We have the resources to gather claims data from your HR team, and then come up with what those projections are. As Craig mentioned, we have several large employers in the area that are on board with Choice Blue or will be introducing Choice Blue. We actually just earned Hershey Entertainment and Resorts business, and they too will be introducing Choice Blue to their employees. So, we're really excited about what this product means, the ability for employers to save on some of these preferred providers. And obviously that savings trickles down to the employees and their families as well. So we're excited about it, and again, are available for some further conversation with your guidance from here.
Thank you. And we will discuss this internally, and if there are questions or if we need to, we'll circle back to you.
Okay.
That sounds great.
Yeah.
And I want to say again, thank you. I appreciate your time, and you can email Doug or myself with those questions.
Yeah,
right.
and special thanks to Mus and to Dave for helping arrange this, and to Jamie as well for helping arrange this. I know it's a lot getting these Zoom meetings scheduled, arranged, and everybody on board in a timely manner. So thank you all, and I hope you have a great rest of your day, and thanks for your time.
Thank you.
Thank you.
Thank you.
Thank you, sir.
There's our happy matrix. Okay. You're muted there, Commissioner Litz.
I'm going to go right into the CARES grant stuff, which is obviously we've been at and working on now for the last couple of months, culminating with the application process from September 1st to the 15th. In the audience right now, the attendees, I think we have all of our working group. Susan, Karen, Jen Kuzo, I see Brooke and Barb Kaufman's there. And we also have a pretty good representation from the panelists who you appointed to review the narrative part of the application. Donna Williams is here, Jeffrey Roche. Looks like Sonia is there. I don't think Christian could make it, and I didn't hear from Pat. So they're here as, I guess, resources if you have some questions specifically. I do want to bring Karen in for sure here first, if I could. And as you know, she did a lot of the work on the application. She's done a lot of the work on, and not all of the work, on assembling the Excel sheet that you were provided in order to look over these applications. We had a total gross number of 292 applications that came in over the course of the 14 days, and they totaled about $3 million, which was surprisingly, I think, exceeding what I expected anyway. And so we went through the process whereby they're out of a possible 100-point score. The data was dependent or was responsible for 80% of that score that we provided in terms of prior revenues, COVID year revenues, and so on. And then 20% of the score was filled in by our review panel, who took into account not only the narrative, but any of the other data that they felt was pertinent. They had access to the numbers to look at. And I'll tell you that each of them spent at least 10 hours, at least 8 hours, some of them up to 12 hours going through these narratives to score them. So we really appreciate the time that they've put into this, in addition to the working group that has now put in weeks and close to months. And I think I shared with each of the commissioners and a lot of the group that speaking with DCED the other day, they were rather surprised that we're at this point in the process, having only received our funds in the third week of August, that here we are just over a month later, poised to award the first of the business grants and nonprofits and tourism. So I'm going to I touched on some of the numbers. You had a chance to look over these. There was a recommended list to you from the working group and the review panel, the efforts that they put in. If you want to start with any specific questions about the Excel sheet, the layout, anything like that, Karen's the person, and same with any of the sorting. We, as you saw, anything with I think 45 points and higher scoring with a full complete application and everything is what we're recommending to you in terms of funding. Which, by the way, I forgot to mention Vin on our work group. I didn't see Vin in the list there. Sorry, I didn't mean to forget him. He was a tremendous help and has been answering questions for some of the applicants and so on, and providing a drop place for the applications for anybody who did a hard copy. So, Mr. Chairman, I'm not sure how you want to start that, but
well, let me just start by thanking this group. So much gratitude to them. Very professionally done. They were working in parallel with us trying to, get this money settled for the county. And so they were ready to go. And here we are in such a short period of time with a very professional analysis of applications by our review panel after, putting together that scoring rubric. And, it just was so well done. I want to thank that entire group of folks that participated at every level for that. I just had a question or two, let's go to questions of my colleagues first. Why don't we do that? And if mine are not answered, I'll ask them. Yes, Commissioner Litz.
Yes, my biggest question revolves around the negative percents. There are 8 recommended funded 4 organizations and 4 businesses that have a negative percent. On the surface, it appears like they are making money by applying for the grant rather than filling a void because they didn't have enough income. Am I misreading this? Can you give me some clarity on this, please?
let me just point out first that the negative number you're seeing means that column is specific to revenue 2019 versus 2020. And so if it says 50%, for example, that means they had 50% less revenue March to July in 2020 than they had in 2019, likely due to COVID. If you see a negative number, like a -4 or -11, I'm just clarifying this, Commissioner Litz. -4, -11, that means their revenue was that much higher. So I just, I know you understand it. I'm just pointing that out for anybody who might be wondering what does a negative number mean. It actually means over the prior year. So,
and for example, the one has a -5% number, which would, based on their $33 million gross means $1,661,688 in additional revenue. That just kind of boggles my mind. And they're applying for a grant, and I don't see where that's filling a void of money lost.
But
What am
that's
I
not
missing?
that doesn't equate to profit, though. That's just pure revenue. Am I correct?
That's true, but I'm basing it on the revenue. I want to understand if I'm misinterpreting it.
If I may, commissioners, I can probably address that to some degree. Because the rubric was set up so that there was different weights to the things that would tell the story of a business's struggle. 20% of that score came from their loss in revenue year over year. The rest of the scoring came from other factors that might not be told in just the income. So that was, what were their unexpected expenses because of COVID? What was their narrative? And that's why the narrative and review panel was also given 20% weight on these. So the rest of the items that tell the story about their need are also scored by various data points, not just revenue. And again, you mentioned that 4 of them were nonprofits. Brooke Smith has been very good at explaining that nonprofits have real irregularities in their revenue streams, depending on when a grant comes in or a donation that has to pass through to something else. So that can really skew, especially a nonprofit's revenue year over year. And so while that is certainly something to look at, everybody was scored the same way based on revenue decline and every other factor, which is where differences in the things that affected a business differently. Some businesses were affected greatly by their revenue decline. Others were affected greatly by COVID costs that they weren't expecting. And so all of those things balanced out to that equalized score. You might have somebody who had that had a lot of revenue decline, but didn't have any additional expenses. They were still able to operate. They had less impact in other areas. And so that's where they balance out to a total score, and why other things have a weight in that final score.
Well, that does help. Thank you for taking the time to explain that.
One other comment to that, speaking specifically about the nonprofits, I think one of them you may have seen in there is Lebanon County Christian Ministries, which we all know is the food distribution point. They got extra money during COVID for food distribution that they wouldn't have normally gotten except for COVID and for CARES. So their revenues are up over 2019, but they're up because they had money in, money out to fill a need. So, that doesn't mean they had necessarily a better year unless you look at it as, a better year in terms of service delivery. They dollar in, dollar out. So
I really appreciate this because I had less than 24 hours to review almost 300 application summaries and digest it all. And those are just the numbers that stood out that I didn't have time to go through every one individually to analyze. So I appreciate the summary. It really helps. Thank you.
And to Commissioner Litz's point, I think it's, I was giving a lot of validity to the scoring rubric, and which does include all those factors. And that's, I think that was a comfort to me in going over this, that all those things were considered, and here's what we're recommending. So that in the short time we had to review, I still, if you have faith in the process and in the weighting factors, I think that makes it easier to support adoption of these that are recommended.
And it's my understanding that the people who did not make the cut, of which there were about 50, would be schooled as to why theirs did not meet muster. It could have been lacking a tax return or some other financial, etc. And they would then have an opportunity to reapply in the second round if they got their information up to snuff, or they could have been just too late, right?
Actually, there were more than 50 in the denial list. If you add in those that scored below 45, as well as those in the 45 to 100 scoring that did not fit the qualifications because of missing documents and things. So
and
there's
what is the
definitely
total?
more.
So it was about 50 that didn't have everything, and then with the ones that were below 45%, what is the total number that might have to reapply if they want to pursue it?
Well, if there were 292 applications, and it depends on how many you pass through for today, but I would guess it's about another 85 to 90 that did not make it.
Thank you.
Okay. Jamie, did you look like you're ready to comment?
I was just going to, I only touched on the score and what the recommendations that are in front of you. I just touched on that briefly. I just wanted to make sure that if you wanted any more specificity on that, Karen's got it. I mean, it's the scoring. It was a recommended cutoff point because, as I mentioned before, the demand for this round was higher than what we had available, and to be able to have a second round and to have a second chance for some of these, we wanted to leave some money on the table for the second round, and so that's why. So Karen, again, it's about 5 point something. I don't have it right on the top of my head, but what is if
the total?
The total, and if we are going to utilize some of the category EDC money for this, which Susan and I have talked about doing, what would the breakdown be for award this time versus remainder for the next round?
So if we're doing everything scoring 45 and higher, you're looking at about 5.7 million in grants, leaving under 3 million for the second round.
Okay.
If you choose to only go with those scoring 50 and higher, you're saving 700,000 for this round that would then carry over to the next round.
So you do have a choice on where you want to draw that line and how much you want to have available for the next round.
What's your pleasure, commissioners?
Well, if indeed the people took the time to apply, met all the criteria, I believe the 45% and up is good. Why make us review those again to come back in? Then they'd be at the top of the pile most likely. So let's take care of those now, and then everybody else gets a second chance, and we'll see how far the remaining 2.5 million goes to those who didn't quite make it this time.
And I would, if you don't mind if I can add in, that those who scored lower than 45, to your point, Commissioner Litz, they are the ones that tended to not have the things that made their business feel like they were at risk because of COVID shutdowns and things. So most of those are ones that had a higher income in 2020 over 2019. They had very little expenses due to COVID. They were able to operate fully. They were, there were things that made them score low because they had much less effect from the pandemic, and perhaps, I'm not sure how to define that as to whether or not they had a need or not, but the scoring tells us that they didn't have the same kind of need as those who are in the higher scores.
Mr. Ames, would you like to weigh in?
No, I'm comfortable with the 45 and taking care of all those folks that qualified under those guidelines. The only question is, I guess, the few at the end that were late. And my feeling in those, just like voting and everything else, if you're a responsible adult and you know the rules, you should follow the rules. And, I think those folks should wait until the next round.
We in concert on that? I mean, if someone would make a motion to that effect, I think this will put a lot of money in a lot of businesses in a very efficient manner in a short period of time. So if you're willing to make a motion, I'd be willing to entertain it.
Do we make a motion on a Wednesday?
I have set this meeting so that it is an actionable meeting. So we've been advertised and did that so that you could hold to your schedule of awarding on September 30th and taking action. So it's been an advertised meeting to do so. I guess Commissioner Phillips, if I could just maybe two more things. One, you have a couple of applications that are organizations that the county has designated that maybe are a little more up to you in terms of how you want to allocate those. So, there was a specific mention in the CARES Act of county fairs, tourism such as Expo Center and Visit Lebanon Valley that we really are, I say as a working group, are leaving to you. Because number one, some of the members of your working group are affiliated there and didn't really want to have any sort of conflict or anything like that in recommending a number to you. And two, you may choose to award something that's not quite within the same graduated scale. So those are something you'll have to look at for, I think, Expo, Visit Lebanon Valley. Karen, am I missing?
Well, there's quite a few businesses that asked to be considered for a higher grant amount, but I do know that the Lebanon Area Fair and the Lebanon Expo were ones that had been discussed in the past by the commissioners as potentially needing a greater grant amount. But there were definitely others who requested a higher amount than they are awarded. They're awarded within their revenue category. But we wanted to leave it up to you to review that list to see if any of them should have a higher grant than their category. I think it's also important to note that some of those that have asked for a higher amount potentially could be given monies from the second round if there is some left over, but that we wanted that decision to be up to you.
Yeah. So those are sort of outliers that I think you may want to look at separately, and we can take a separate action on that at another time for those particular ones. Related to second round, by the way, there's potential, and this is not to make any guarantees to anyone or give hope to anyone, because I have no way of knowing at this point, but there's potentially a third opportunity here. I think as you as commissioners know, that the way the CARES Act in Pennsylvania, the way they're carrying it out is working is that by November, I think it's by November 15th, any of the CARES funded programs in the Commonwealth, except for this one, except for the county block grant relief, are on November 15th are to report back to DCED with any unspent funds. DCED may then compile all of those unspent funds and redistribute them through the counties to be used in the same manner as this block grant. So the potential is there. And again, no promises. I don't want people counting on this or anything, but the potential exists that we could go through our 2 rounds and find ourselves in the middle of December getting another allocation that we literally have 2 weeks to expend. So it'll be valuable to have all of this data, and maybe, after the second round, even having some who are unsuccessful or for whatever reason that we could still possibly address if we're poised to do so in December.
Or the larger amounts could be awarded from any extra funds that we get.
Yes, you'll have a lot of flexibility there if that happens. And then the last thing I just wanted to mention is that I described who we have as attendees here. I don't know if any of them wanted to add anything before you take any action. We're doing pretty good on time, but if any of the review panel, again, they worked very hard. Some of them spent a good part of their weekend going over these. Some of them hit them hard right away as soon as they received them. And I don't know if anybody has anything, if you want to raise a hand potentially, if you'll entertain that, commissioners. Not seeing any at the moment.
So Jamie, I'm trying to interpret your intentions for the fair and the expo, for example. You would prefer to do those separately on another occasion or separately after this motion? Or
I don't know how much time you had to review those in particular. To consider
I did not
those.
see those.
They're on the list.
I printed out the recommended list and I didn't see them. Which list are they on?
They'd be on another tab because we didn't.
No, they're on the recommended list.
Oh, I thought
They are.
Whereabouts?
The fair and the expo center, I know are.
The Lebanon Valley Expo is on line 130.
Oh boy, it didn't print the numbers out when I printed it. So there's 1, 2, 3, 4, 5, 6, 7, 17. So 130.
page 8.
Yes.
Am I guessing right? No, that's good.
Oh, I thought you said, "Hey, Jamie." I didn't hear what you said.
Oh, no.
Hey, Jamie.
But I just, those are huge impacts on the county, both of those entities. And so they ripple through the agricultural areas and also to the tourism. A lot of weight should be given, in my opinion, to both of those. But I don't know if we want to discuss a number today for each or we want to.
Yeah, I wasn't sure either. That's really why I
Okay.
picked it up.
All right. And Commissioner Litz, we don't really need to, it just depends on whether you want to, conclude that or you want to put that off to another day for a discussion when we have a chance.
Okay.
You have the column that shows what category they applied under. The Lebanon Area Fair is the third tourism one, and the expo is about 10 down. So
Okay, I see the expo at 50 and the tourist promotion agency at 35. So they are included. So I think we're good for that, but any extra we can discuss next time. But at least I have some working capital then.
Well, may I just for a moment, so what if my numbers were, much higher than that. And I guess I'm wondering, do you want to take a chance at taking money out of a future allocation, or do we want to just address it now and make those adjustments now? We've heard Commissioner Litz's opinion.
I don't have, I'm sorry. Like I said, I had trouble opening the program first and I just lost so much time. I don't have the total numbers for comparison. I thought if we could do this list, then I'd have more time to analyze the rest and ask my questions so I don't tie things up. I'd really like to get that right. And I would like a little time.
All right, well, can we pull those two out of this round altogether and just make an allocation at another time for them? Or is that not necessary? Just give them what we have already approved?
That's what I'm thinking, Commissioner Phillips. If we just give them what's been approved on this list, make a note that to revisit these particular ones that we would like to make an adjustment in, and work that way. It would free up some cash for them now.
Yes.
All right, that's fine with me. I just want to make sure that they're aware that this isn't the last, consideration for them. Okay. That's fine. All right, so we're back to, do we want to make the motion about the 45 scoring group and above? If we make a motion, if we're ready.
The 45 scoring and above, and include all those entities that applied within the time guidelines.
I'll make that motion.
I think you're seconding it, maybe.
Oh, am I seconding it? Okay. I didn't hear
I
him
think
say
so.
move.
Oh, was that a motion?
Yes,
I assumed it was a motion, that you weren't just feeding her the motion. So now if there is any further discussion, we can do that. Jamie or Karen or anyone else have anything before we vote?
Just want to mention that these, while you're approving these awards, there still may be some vetting that we would either need more information or we discover some information about a recipient that we'd have to go back to. And, if we're any outstanding tax records you might be concerned with or something like that. I just want to qualify that these awards are being, you're recognizing these allocations, but we still may have some of that to go.
Okay, yes, Commissioner.
Okay, so as the applications are vetted for the final qualifiers and they are completed, will checks be mailed out as you go, or will they all be held and sent out at one time? And if that's the case, what is the time frame?
Well, the time frame is that we want to notify them as soon as we possibly can. We will then get to them. They'll have to have a grant acknowledgement agreement, and we're going to need a W-9 back from them. And so as those come back, we'll process them. The controller's office is prepared to do these on a demand basis, so it's not going to take the typical payable cycle. We'll do these as we get them. So we'll do them in batches as we're able to do that.
So the total processing time might be 2 weeks for everybody, or for the first ones, or 2 weeks to 4 weeks, or?
Well, it depends on when they sign the grant agreement and to get the W-9s in. Then there's going to be a little bit of time after that, I think is what I'm.
Yeah, I would say that from the time we get the information back from them that we need, it's probably just a couple of days.
Yeah, that's what I'm hearing that.
Yeah.
And who is going to do the final vetting for any taxes owed and things of that nature?
I'm going to see if I'm going to speak with the treasurer's office and have them with the award list and see if they can identify any there, and if not,
Which is that, the controller's office?
treasurer's office with tax claims.
Treasurer's office. Okay, thank
Right.
you. And would that include the state and federal taxes?
Probably not. I said to Karen earlier, it's tough with, for example, sales tax. I mean, if someone is slow or late on sales tax, I don't think we have any way of knowing that inside of the Department of Revenue. It's only once they become, delinquent, and then there's a lien filed, for example, by the Department of Revenue, is when it really comes about. So it's kind of hard to know. I mean, if someone is still considered current, but maybe they're, not delinquent, there's honestly only probably so much we can determine.
Well, I guess the reason I asked this question is because I seem to recall in our signed agreement with the state that everyone must be in full compliance, and that would include paying taxes. So I don't know what the state has in mind, because we have to repay it, then we have to go after the person we gave it to get it back, and it's a really long process. So I didn't know if we could cut it off at the head to say, you pay up and then you get your money.
Well, they signed off on the application that they are certifying those things. It'll happen again on the grant agreement. Are you asking that we give a clean bill of health before we cut a check so that we can not have it? I mean, the recipient risks potentially having to pay it back, but I don't know how we can vet the whole process to hold the check until we're certain, for example.
I'm not in favor of that approach. I think if they're signing and they're attesting that they are in compliance, then if they are fraudulent in that signature, then I think we deal with that subsequently. But I don't want to hold this process up. These folks, this is a historic opportunity for us to get money in people's accounts, and it's been vetted to this extent, and I don't want to hold it up for. If we have to trust people at a certain point, and if they're having to sign twice that they're compliant, if we find out different on a couple of them, we're going to have to deal with that, I believe is the answer for me. Anyway.
I hear what you say, and I agree with a lot of what you say, but I also know that we are the fiscal watchdogs and responsible And it wouldn't be fair to other taxpayers if we didn't do our due diligence and make sure that they are in compliance. And
who, Commissioner Litz, is going to check all those? Are you expecting the folks that have already done all this work and give them another assignment now to check the eligibility of each one of these people that is already attested to the fact that they are in compliance? I don't
Jamie
think that would be fair.
Jamie said the treasurer would be checking.
For the local
if there's
tax, that's easy,
I
but
don't
not
know
for the state taxes.
I don't know if there is a single point of contact at the state that a list could be emailed to ask for compliance. If they are in compliance, that would be at least something we could check.
Have you dealt with the state lately? Because I have had a few occasions to deal with them, and just to get someone to answer a phone call really takes a separate act of the legislature.
Well, I think we've done our due diligence to this point. It's not exhaustive, but it is certainly, we've done a very responsible job in this, and I would not want further delay of getting this money in the hands of the people that need it. And I'm going to call for the question. Okay, any further discussion? All in favor indicate by saying aye.
Aye.
Opposed?
Say aye, but I would also like to comment.
What? You want to, so you are an aye. So
Yes.
Okay, now you have a comment after the vote. Okay.
Yes. I would also like to request that we, the treasurer's office make an attempt to see if is there a single source from the state that can verify that all of the state taxes, be they sales tax or income tax or whatever, are up to date. And that way we would have something in our file to show that we took that extra step. If it's not available, then the signed agreements obviously are going to have to hold up, and we'll do it one-on-one. But if something gets vetted right away, there's nothing wrong with that.
Okay, Jamie, we will ask that question, but we have a motion that's been passed so that we have done this part of our job. And again, with thanks to the folks that gave so much time in not only producing this process, but also the review panel. I mean, this is all a lot of work that's been done at a high quality and very efficiently. So I want to extend thanks again for all that.
Yeah, Mr. Chairman, not that I can say anything really any differently or any better than you've already expressed it, but I just would not want to forego the opportunity to thank Karen and all of the folks that have worked so hard to make this process work, and I know to make it fair and equitable. So as a county commissioner, ultimately responsible for these decisions, I appreciate everything that all of you have done. Thank you.
And I'd like to echo my complete and utter thanks, and also upholding that you have contributed and been fair and honest and gone above and beyond the call of duty, so to speak, to assist the county with making sure our businesses, our nonprofits, and those who have really suffered while trying to provide jobs for people are made whole. Thank you so much for everything you've done.
Okay, Karen or Jamie or any of the other folks in the support capacity that would like to have a comment, or are we finished for today?
You're on mute, Jamie.
Sorry, my phone was ringing, so I muted it. I'm good. I'm still looking. Any last raised hands from anyone who has assisted here with this? Looks like Pat Kerwin's with us now.
Hello, Pat.
But nice to have a mute button last night. Just kidding. Okay. Yes, Karen.
If I may comment, I am eternally grateful to have been part of this process, working with an incredible team of people who I think are so fair and well thought through, and all of the actions that were taken. The fact that we are now at the point where a vote has gone through makes me so proud and happy that we can start to provide relief. When you hear the stories of these businesses that are the vitality of our county, to be able to offer them even just a small lifeline is amazing. So thank you.
Awesome.
Thank you.
Very good. All right. Thanks again, everybody.
All right, if you would, since you're in a regular meeting, if you would adjourn this one as you typically do, and then we'll get you your data, your information for tomorrow's meeting. If you don't already have it, we've got a full schedule of things for you to act on.
I make a motion that we adjourn.
All right.
Hey, thank you. We stand adjourned. Thanks.
Thank you, everyone.